Hello mga ka-listeners, welcome again to my topic. At this moment, I will discuss to you the overview of cephalosporins. Okay, what are cephalosporins? Cephalosporins. Actually, your cephalosporins are related to penicillins. Related to penicillins. If you still remember the antibiotics, four antibiotics that are said to be a beta-lactam antibiotics. So again, your PCCM. Your PCCM. PCCM. P stands for your penicillin. Penicillins. C stands for your cephalosporins. Cephalosporins. Another C stands for your carbapenems. Carbapenems. And M is your monobactams. Actually, they are what we call your beta-lactam antibiotics. Since cephalosporin is one of the beta-lactam antibiotics, pag sinabi nating beta-lactam antibiotics, they consist of beta-lactam ring. So expect that your cephalosporin has also a beta-lactam ring. That is why I said it is related to penicillins. In terms of their action, actually your your cephalosporins are bactericidal and bacteriostatic. Bacteriostatic. And the action actually of your cephalosporins inhibits cell wall synthesis but are less susceptible to penicillinases. If you still remember your penicillinases, this is actually your type of beta-lactamase. Since I mentioned beta-lactam antibiotics and penicillinase as one of the type of beta-lactamase, an enzyme that can destroy the beta-lactam of the penicillins, cephalosporins, carbapenems, and monobactams. Once they destroy the beta-lactam ring, these antibiotics, especially your cephalosporins, loses their antibacterial efficacy. So mawawala ng bisa. Penicillinases. It is called penicillinases because since it is a type of beta-lactamases, it targets specifically your penicillins. So a type of beta-lactamase that targets specifically your penicillins are your penicillinases. Very good. You can still remember. Another thing about your cephalosporins is that if you are allergic to penicillins, since your penicillins has a beta-lactam ring, they share similarity. Chances are you can also be allergic to any drugs under your cephalosporins. Again, if you are allergic, if you are allergic to penicillins, then you are allergic also to the cephalosporins. Again, if you are allergic to penicillins, you can be allergic to cephalosporins. That phenomenon is what we call cross sensitivity. Cross sensitivity. It is because the molecular structure of your cephalosporin is the same with penicillin. That is why they share similarity, commonality, because of the beta-lactam ring. Again, if you're allergic to penicillins, chances are you can be also allergic to cephalosporin. That is why a nurse should ask the patient before giving also a drug if she or he has history to allergic reaction to penicillin. That is a very important thing. Again, in terms of the mechanism of action, since it inhibits the cell wall synthesis, if this is the cell, the outer part is the cell wall. Once it inhibits the cell wall, the bacterial cell wall, then the bacteria may eventually die. And also, your cephalosporins are classified or categorized into 5 generations. What are these 5 generations of cephalosporin? First generation. Actually, your first generation cephalosporin are effective to both gram-negative and gram-positive bacteria. Your second generation are less effective to the gram-positive bacteria, but they are effective to gram-negative bacteria. Your third generation cephalosporin are weak against gram-positive bacteria, but they are effective to gram-negative bacteria. Your fourth generation cephalosporin, actually, they are also both effective to gram-negative and gram-positive bacteria. Last is your fifth generation. Your fifth generation is said to be broad spectrum. When I say broad spectrum, since I already discussed about the spectrum of antibiotics, it can be broad, it can be narrowed. Since the term here is broad spectrum, the type of antibiotic or a fifth generation cephalosporin can also be effective to both gram-negative and gram-positive. So that is why broad spectrum. And I would like to emphasize that fifth generation cephalosporin are effective mostly against the gram-positive bacteria, especially towards the MRSA. What is MRSA, by the way? If you're familiar with MRSA, MRSA is your methicillin resistant staphylococcus aureus. Staphylococcus is the name of bacteria that is resistant on your methicillin. Methicillin is also a type of what? A type of penicillin drug. Type of penicillin. So as a whole, generally, the bacteria that is resistant on your penicillin is said to be your methicillin resistant Staphylococcus aureus, or your MRSA. Another thing that we need to discuss also is the side effects of your cephalosporins. What are the side effects? Commonly, most of the side effects are GI side effects. It is your NV DAF, your nausea, your vomiting, your D stands for diarrhea, A is your abdominal pain, F is your flatulence. Okay, flatulence. I also want to emphasize the adverse effects, the potentially dangerous, potentially dangerous adverse effects is your pseudomembranous colitis, pseudomembranous colitis. Actually, this is an inflammation of large intestine due to overgrowth of your Clostridium difficile, to overgrowth of Clostridium difficile. Yes, letter I, then double L, that is difficile. It is the name of bacteria, Clostridium difficile. Again, the side effects of your cephalosporin are commonly have a GI. It affects the gastrointestinal system. That is your nausea, vomiting, diarrhea, abdominal pain, and flatulence. How about your adverse effect? The potentially dangerous adverse effects that nurses must be aware of is your pseudomembranous colitis, an inflammation of the large intestine due to the overgrowth of your Clostridium difficile. Another thing we need to consider is when to discontinue the cephalosporin. Okay, discontinue cephalosporin if there is, yes, very good, if there is bloody diarrhea. Another thing is if there is severe abdominal pain. Okay, sir, what are some examples of the cephalosporin? Okay, I will give you some examples as an overview. We have your cefazolin. Okay, your cefazolin is a drug of choice. For surgical prophylaxis. Of abdominal operation, and also for implant surgery. Actually, when we say prophylaxis, a form of prevention, like for example, if the patient undergoes an operation that will involve the large intestine, part of your gastrointestinal tract. So, kapag kasi inopen ng doktor yung kaniyang intestine, chances are the bacteria, some of the inhabitants there, may spread over the other organs, and it may eventually cause infections. To prevent that, the patient may take this type of cephalosporin, a kind of example of cephalosporin is cefazolin, in order to prevent any form of infection as per ordered by the doctor. And also your cefaclor. I think you're also familiar with the cefaclor. Actually, your cefaclor is safe for pregnancy. Safe for pregnancy. We like also just to emphasize those important points. Safe for pregnancy. Because not all cephalosporin are safe for pregnancy. They are said to be teratogenic. And another example is your cephalosporin. Cepho, letter F, cephalosporin, cephalosporin. If you notice that there is there's ceph, that is some of the indicators that they are actually the example of your cephalosporin. And another thing is your ceftazidime. Okay, ceftazidime, actually they are active for Pseudomonas. Since I mentioned there are cephalosporin that both active to gram-negative and gram-positive kind of bacteria. I'd like also to emphasize that gram-negative, aside from they have a thin peptidoglycan, as I said, they are commonly associated to respiratory tract and soft tissue infections, while on the other hand, the gram-positive, aside from having a thick peptidoglycan, they are commonly associated with your genitourinary tract and gastrointestinal tract infections. Genitourinary tract infections examples is your urinary tract infection, your UTI. And while the GIT example of your GIT infections, some are intestinal infections caused by some susceptible bacteria. While on the other hand, respiratory tract infection, one of the common example is your pneumonia. Pneumonia is one of the respiratory tract infection. And there are also other infection that can be caused by the gram-negative bacteria. By the way, moving on, another example is your, as I said, your cephalosporin, ceftazidime, that are active for Pseudomonas or Pseudomonal infection, an infection caused by your Pseudomonas aeruginosa. Another thing is your ceftriaxone. Cefotaxime. Another thing is your ceftizoxime. From ceftazidime up to ceftoxizyme, actually they can cross the BBB. What is BBB, guys? That is your blood-brain barrier. Again, your blood-brain barrier. Actually, your blood-brain barrier, it protects your nervous system, especially the brain, from any offending agent such as your bacteria or any noxious stimuli or any chemicals, because there are certain drugs also that can pass through the BBB, and since they can pass through the blood-brain barrier, they can be used to what? They can be used for treating bacterial meningitis, for treating bacterial meningitis. You know what is meningitis? That is the inflammation of the meninges. Since meninges is the covering, it acts as a covering for the brain